Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in our Going Deep segment brought to you by CO2 Lift. Today, we're featuring Dr. Alfredo Hoyos, an expert in plastic and reconstructive surgery from Bogota, Colombia. Dr. Hoyos is an innovative surgeon, sculptor, and artist, creator of high-definition liposculpture. He's the author of 2 scientific books, Total Definer, Atlas of Advanced Body and Contouring and High-Definition Body Sculpting, and Art and Advanced Lipoplasty Techniques. He joins me today to talk about liposuction safety, tips and techniques, and the risks and rewards involved. Now, in recent statistics, liposuction overtook breast augmentation as most popular cosmetic surgery, amid growing concern, of course, about the implants linked to cancer. According to newly published data from the International Society of Aesthetic Plastic Surgery, the contouring procedure, which uses suction to remove excess fat, accounted for about 15% of cosmetic surgeries performed worldwide, while the equivalent figure for breast augmentation fell to just over 13%. Changing trends are part of a global surge in aesthetic medicine, which saw over 30 million surgical and non-surgical procedures carried out in 2021, and that's a jump of close to 20% from the previous year. Staggering numbers. Welcoming now to the show to help me break it all down is the amazing Dr. Alfredo Hoyos. Welcome to the show, superstar.
Thank you very much. Thank you very much for the invitation.
We are so excited to have you on. You are an expert in your field, and we can't wait to chat with you. Could you please start by sharing with our audience your journey into the world of high-definition liposculpture and advanced body contouring, and really what inspired this career path?
Well, I think high definition started almost 20 years ago. And I think it was partly because I'm an artistic, expert as well. I'm an artist, and one of the things that we lacked back then was the possibility to do through liposculpture a good artistic work. So what we combine is the artistic portion, mixing it with the external anatomy that you should have. So the result at the end is having a very natural, but at the same very athletic appearance, both in male and female.
That's a fascinating career path that you merged the two together, because one would think they're worlds apart, but after what you just said, they really run parallel to each other. Now, I'm going to assume that the best candidates for liposuction are patients who already concentrate on a healthy diet and exercise as part of their daily regimen. Of course, this procedure doesn't cure or combat all aspects of obesity or get rid of cellulite. But now, if you exercise regularly, to my understanding, you still have unwanted belly fat for most of the population. That just won't go away. Liposuction is a safe and effective procedure that uses a much smaller incision than, like you said, past methods required. But you're the author of 2 scientific books on body sculpting. Could you provide a brief overview of the key principles and techniques discussed in your books and how they have contributed to your innovative approach?
Yes. So the idea is this, only 5% of the population can have, through diet and exercise, the perfect body. So having that in mind, the idea was to provide specifically to the surgeon the tools to make it happen in terms of providing to these patients a perfect anatomy experience in terms of combining the surgical procedure with the artistic portion of it. At the end, these 2 books actually provide to the surgeon the guidelines for doing every single aspect of the muscular anatomy, the arms, the pecs, all the anatomy itself, and including, but not forgetting that most importantly, the abs for everybody.
It's funny because when you think of liposuction, you think of women, right? Now, women tend to gain fat in their stomach and their hips and thighs, but men also suffer from gaining in their midsections and chest areas. So this is both effective for both men and women, and they can both benefit from this treatment. So I love that. Now, liposuction has been around for many, many years, but your work has really advanced the field significantly. What are the primary differences between traditional liposuction and your high definition liposculpture technique?
I think high definition was a leap in terms of what we can obtain with true liposuction. Previously liposuction was dedicated only to do deep liposculpture, taking out the deep fat. That was the extra fat that we used to have, but not literally carving it into an artistic work. And most of all, what we can do with high definition was to treat both of the two layers. We have a superficial and a deep layer, but also to create the artistic portion of it. So making translucent the anatomy through the skin. So with that, what we combine is liposuction in one area, and on the other area, we combine fat grafting. We can do the fat grafting into some muscles, specifically in men, for instance, the pectoralis, the abs, the arms. In women, we can do it in the legs, for instance, in the gluteal area. So we can combine it in different regions as well. Right now, for instance, in the gluteal area, we do it only subcutaneously. But in other area, for instance, like the legs in women, we can do it even inside the muscles to provide an appearance that it looks more athletic.
It's incredible if I'm closing my eyes and I could see a body being contoured like this while somebody is, in under general anesthesia, and you working your magic to really sculpt it. It's really, when you think of it, it's like, you have a canvas and you're like a Picasso at that point. So it's fascinating. But safety, of course, we know is a significant, and I mean significant concern in any surgical procedure, specifically liposuction. How have you addressed the safety aspect of liposuction in your practice? And what advice do you have for patients seeking this procedure, especially leaving America? You're currently in Bogota, Colombia, and you're very well known. But what's your advice here?
Well, my main advice is to go to the right surgeon. Usually a board certified surgeon is literally like a stamp of good standing and good position. Usually people that are certified, usually they have to go through processes and also to have like continuously getting things up to date. So for instance, we created our own congresses in terms of safety. Actually, it's called total safety. And in that sense, the idea is to provide three things. To provide first the safety for the surgeon, safety for the patient. So in terms of liposuction, what we want to do is extract the most that we can out of the patient without compromising his health. The idea then is to provide less bleeding, less swelling, prompt recovery, sooner recovery, and a safe recovery. So those are the three aspects that we have on. The pre-op, intra-op, that is mainly keeping the safety in terms of diminishing the bleeding, and the post-op care to making the swelling and process and the fibrosis to recede very quickly.
So it's not just a black and white situation. There are many protocols that you follow to ensure maximum safety. Now, can you discuss some of the potential risks and complications associated with liposuction, and how do your techniques, or your advanced techniques, if you will, mitigate these risks?
So we have mainly 3-4 risks that we have in mind. The first one is bleeding. We usually treat the patients with specific medications to provide less bleeding. Specifically, we're studying substances like tranexamic acid. The second one is thromboembolism. So preventing thromboembolism is a key for us. So with that, we actually do also some prevention mechanisms, like giving some medications to prevent this thromboembolism to appear. The third potential risk is infection. So we try to prevent infections, to provide like prophylactic antibiotics and so on. And I think the fourth one, that is one of the most difficult ones, is the necrosis of the skin. To overdo, to making these patients to have like less vascularization over the skin because it's over resected, especially in secondary patients where they have previous liposuctions, that they might have some problems over the vascularization of the skin, specifically what we call the subdermal plexus. So in that sense, we also are studying some substances in order to prevent necrosis and to prevent especially bleaching of the skin or stains on the skin of the post-op care.
And this is why you said make sure you go to a board certified surgeon, because there's a lot of knowledge that goes into not just safety, but into obtaining the incredible results. I'm going to shift a little to CO2 lift. So both CO2 lift and hyperbaric oxygen therapy utilize oxygen in their respective processes. In CO2 lift, carbon dioxide is applied to the skin, and the skin is expected to absorb this CO2 and in the process release oxygen, potentially improving skin health. Now, in a hyperbaric oxygen chamber, pure oxygen is administered at increased atmospheric pressure, and the higher pressure allows the body to absorb more oxygen into the bloodstream, which can be beneficial for various medical conditions. The common thread between the two is the focus on oxygenation of tissues, albeit through different methods. Now, I'm going somewhere with this. So, comparing CO2 lift to a hyperbaric oxygen chamber suggests that there may be some similarities on how both treatments incorporate the use of oxygen. Now, you are familiar with CO2 lift, and it has been compared to this hyperbaric oxygen chamber. Can you speak to this in your own experience with patients, and what results and outcomes have you found?
So usually our main concern after surgery, and specifically, for instance, when we have flap surgeries, like say a tummy tuck or in a facelift, we have to raise the skin and we have to raise what we call a flap. This flap has to endure some diminishing of the O2 levels, so meaning that we have less vascularization of these areas. Specifically in liposuction, we do secondary liposuctions. We cannot ensure the vascularization as well. So to treat that and to prevent necrosis, we actually have these two powerful tools. If one is the hyperbaric chamber. The hyperbaric is very efficient. They actually comprise not only 100% oxygen, but we raise also the pressure. The idea is to raise it to 1.8 atmospheres, so it's 2 times the level of pressure that we have of oxygen normally. That actually compresses the oxygen and makes it literally to go all the way into the tissues, even the tissues that have less vascularization. Provided that, the thing is very difficult to have access to it. It's a very expensive device. It has to be in expert hands, and also it has to be in a specific areas. Sometimes they don't have public ones. Sometimes they have to go to a military hyperbaric chamber. So it depends on the availability that the surgeon has in a specific regions and in a specific city. The CO2 lift is literally what we call a topical. So actually you put it over the skin. And it's a combination of products that actually release CO2 into the skin. The variability is that we usually do that, but we have to inject it. You have to go through a needle, go through the skin, and inject the CO2. The CO2, what it does, it creates a vasodilation. We actually create a revascularization, and we generate more blood vessels. That's the key of providing the CO2. So when I run into this product, I say, okay, what you have in hands is gold here, because it's not only for cosmetic purposes. When I found it, they were only used it for cosmetic purposes, just for doing the neovascularization of the skin and doing rejuvenation of the skin. But the main point here is that it can provide through the skin, without having to puncture the skin, the same CO2 levels in higher doses, and even for higher periods of time than even the injection. So with that, we can have a very powerful tool to induce vascularization in the areas that we have, to spare these flaps, and we have it in a safer, more efficient way with very easy availability as well.
You're preaching to the choir. I personally use the product. I've used the CO2 Lift Pro on my skin. I use the CO2 Lift V for vaginal rejuvenation, and even on.
I can see that.
Yeah,
That was amazing.
I've been using it. I'm a big fan. So I'm glad that that you've also echoed the same sentiments in terms of proprietary uses for this product. Now we have about a minute left, but many people are interested in liposuction for cosmetic purposes. Obviously, that's why they come to you. What is the typical candidate for high definition liposculpture, and what kind of results can they expect, and how quickly?
Well, the high definition is not for very obese people. So usually we consider the BMI, that is the body mass index, below 30 in women, below 32 in men. With that in mind, the leaner, the more stronger muscles you have, even if you have fat, the better results you're gonna have. So if you go to a gym, keep going to a gym. Liposuction is not gonna replace it, but it's gonna be a powerful tool to go to the main circle of getting fit.
Well, there you have it. We are officially out of time, my dear. Thank you so much for coming on. It was an absolute pleasure speaking with you. You are an expert in your field because you are just full of knowledge and you do the research and your homework. And you are, of course, an author, which makes me even more comfortable to come get treated at your office.
Oh, thank you very much for the compliments. And thank you very much for the invitation.
Absolutely. Guys, not vetting your doctor can have serious consequences. Speaking of your liposuction surgeon, the body contouring procedures should only be performed by a qualified board-certified plastic surgeon with liposuction experience, like Dr. Hoyos. Selecting an inexperienced or amateur provider will, in fact, jeopardize the results as well as your health and safety. That was our Going Deep segment brought to you by CO2 Lift. You can definitely find Dr. Hoyos all over the gram. You can check him out at totaldefinermasterclass.com, or you could also head to totaldefiner.com, on the gram at Alfredo Hoyos MD or at Total Definer. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2lift.com.